from the Top. View from the Top is a quarterly series of the Brampton Board of Trade where we invite leaders from our community to share their insights, their forecasts, and secrets to success. We've profiled leading manufacturers, our regional police chief, the president of our local college, and today we welcome Dr. Mohamed Lachemi, President and Vice-Chancellor of Ryerson University. Welcome, Dr. Lachemi.
Thank you very much. Very pleased to be here with you.
Well, we have some very exciting things to talk about today, Dr. Lachemi, but why don't I just take care of a couple of housekeeping and I'll formally introduce you and then I'm really looking forward to our conversation. I know that our members are very eager to learn about the next Ryerson innovation and investment in Brampton. Ladies and gentlemen, we really appreciate you joining us here today, and we're using the Hop-In platform. There's plenty of time for questions, so if you'd like to put your questions, please do put them into the comments section, which I believe is on the left hand of your screen. And if you're, the expo as well, if you haven't already taken advantage of that after our presentation today, check out the expo. There's an expo icon, there's a chat icon, and we really look forward. I was just speaking with Dr. Lachemi and really looking forward to getting your feedback and your questions as well. Today's session is brought to us through the generosity of four sponsors of the View from the Top series: CN, Deloitte, Meridian, and Rogers. We thank those sponsors very much, for which this series would not be possible. Ladies and gentlemen, we are just so excited that Dr. Lachemi is here today and to provide us with an update on Ryerson's plan. In the most recent provincial budget, Ryerson University received an allocation from the Government of Ontario that will support in the developing of a proposal for a medical school here in Brampton. And this is very exciting. The proposal will deal with Ryerson's plans to expand investment in Brampton, and particularly in health innovation and health education. This particular investment will focus on primary care, expanded use of technology to better meet patient needs, and an interprofessional practice for the provision of culturally competent care. So it's a very unique medical school, not one that I think will really complement the Ontario landscape. Before we get into our first question with Dr. Lachemi, let me tell you a little bit more about his illustrious background. It's a really interesting one, a gentleman with a very curious mind that has excelled in many fields. And let me just share with you, his background has truly been an inspiration. His inspiration was to pursue an engineering career, and it came in a single moment when the ground shook violently one day in North Africa. Dr. Lachemi was a high school student in Algeria at the time when a devastating earthquake struck his small town. The quake killed about 4,000 people and leveled many of the town's buildings. In the puzzling aftermath, as you can imagine, Dr. Lachemi found his life's quest. I had to know, he said, I had to know why some buildings were still standing and others were completely destroyed. I could see that engineering has the power to save lives. And that began his global journey as an undergrad and grad student in engineering, as a university faculty member, an internationally renowned researcher, dean, and ultimately the president of Ryerson University. So researching and developing strong, durable, most importantly, sustainable concrete has become his research focus. But I can tell you, he is also very good at cementing positive community relationships. And Dr. Lachemi, we're just so happy that you're here. You are a resident. Your family chose Peel Region as the place to live, and you've been a resident here now for over 25 years. Please join me in welcoming Dr. Mohamed Lachemi to our podium here today. Welcome, sir. How are you?
Very good. Thank you very much for that nice introduction. I can tell you I'm excited about the opportunity and very happy to be with you this morning.
Oh, very good. Well, we have a couple of questions that we start, and I see that there's some good comments coming in on our stream as well. Why don't we start with the medical school itself? What was your rationale, the logic? What was the draw of Brampton in being selected by you for pursuit of investment of a medical school here in our community?
That was an excellent question, Todd. As you mentioned, we have been, with my family and myself, living in the Peel region for almost a quarter century now. So I'm very familiar with the region, and also, of course, very familiar with the city of Brampton and the opportunities in the city of Brampton. I would say the discussion actually about doing something in Brampton started, I would say, exactly 7 years ago with our former late Premier Davis, who called me out of the blue saying that I have seen what Ryerson University has done to transform that part of the downtown east in Toronto. When I was Minister of Education, that even before his time as Premier. And he said, it's about time to think about the future of Brampton, my city. As you know, he always defended Brampton. And he invited me at that time. He was co-chair of the panel to think about the presence of a post-secondary education. He invited me for a conversation with the panel, and I came to Brampton. We spent a couple of hours on a Friday late in the afternoon talking about our vision, and all started with that type of conversation. I have seen the energy of the panel members, and then the need to do something about the future. In terms of why, in particular, the city of Brampton, we all know that Brampton is one of the fastest growing cities in the country. Is one of the most diverse cities in Canada, if not in the world. The other thing that really of great interest to my team and myself is actually the quality of the youth. You have a lot of talented youth. The city is young. I believe the average age is about 34. Compared to many other cities, that's actually very, very low. And as I mentioned, for me, the main driver is really about talent. And I'm always impressed by the motivation of those talented people, the youth, about the future. And I'll tell you just yesterday, actually, I am spending a lot of time in Brampton these days. This week on Monday, we had actually a good conversation with a number of cabinet provincial ministers about what we are doing in cybersecurity. And the best message that you can send to governments is really to let them talk to the those young entrepreneurs. As you know, we are doing a lot of things in terms of cybersecurity, in terms of training, in terms of innovation, entrepreneurship. And we have a number of entrepreneurs that are actually pushing the boundaries to create opportunities for themselves and for others in Brampton. And after that visit, a couple of ministers said, wow, that's very powerful. So that type of motivation. And yesterday, I'll just give you I met with somebody from Brampton. His name is Akash. And I asked him, what's the meaning of your name? He said, sky. And he told me, I want to push boundaries. He said, I'm 25, and I'm thinking about the next 40 years of my life, and I want to push boundaries. And he said, my only limit is sky, which is his name. That kind of message is very powerful. And from that perspective, I would say the city of Brampton is a city of the future. And because of that, it needs a medical school for the future. The other element that is very important, and I know that we have a number of people from William Osler, the pandemic has shown that Brampton is underserved on healthcare. And I always give credit to the wonderful work done by Dr. Naveed Mohammed and his team dealing with the pandemic. They have been under huge stress, but as we say in French, chapeau for their contributions and their leadership. The other thing that I think is important is in healthcare, there is a need for equity, diversity for future healthcare services and operations. And as I would say, we're better to come than Brampton. In terms of our work, Ryerson University and Brampton work very well together. We have, as I said, started this journey a number of years ago. We have existing strategic partnerships. We have the Rogers Cyber Secure Catalyst. Because of that, actually, Brampton is now the capital of cybersecurity training and innovation in the country. We do have our venture zone that is helping people to create opportunities, jobs for themselves and for others. And then we launched also another interesting venture, which is the helping people who are coming from outside the country with medical credentials. So we have a program, training program for foreign trained doctors. So those are kind of the number of opportunities and initiatives that we have. And the other thing that I think is extremely important, Brampton is part of an innovation corridor. And we all know that Toronto Waterloo corridor is one of the most important actually on the globe. Actually, Brampton is actually mid-distance of that corridor. This is an innovation project in terms of healthcare that can really be a magnet for talented people, magnet for investors from private sector, from the public sector. And we truly believe that we can create this innovation healthcare district that will serve not only the region, but this can serve the entire province and the country. My last point here, Todd, we want also many of our students to come from the region, from Brampton and from the Peel region, because they understand the reality of the communities in the region, and they can serve them after graduating. So we want them to really stay there after graduation because they understand what are the best ways to help people in the region.
Dr. Lachemi, thank you so much for what I think is one of the most comprehensive business cases for selecting Brampton that I've heard of in a long time. I'm heading south of the border next month to a convention of site locators where I'll be raising the flag for Brampton, and you truly, sir, have our ambassador for our community. You mentioned so many important things: the leadership of Osler, the collaborations that you've and partnerships that you developed with the city council, with the business community, the young age of our workforce, the diversity of our community, the network that a medical school can draw on along the corridor. These are all very, very compelling reasons for selecting Brampton, and we thank you so much for articulating that so well in your pursuit of this, and particularly in your pursuit of investment. And congratulations again for the positive nod from the provincial government in the last budget. Dr. Lachemi, I understand that the school will be founded on 5 particular pillars. I'm wondering if you can tell me a little bit more about that, pillars that are directly applicable to the business and academic environment here in Brampton. And I understand from your pitch to the province that this will be a medical school that will provide culturally appropriate care, best use of technology, and technology is changing so quickly, and the interdisciplinary collaboration between disciplines, between institutions. So I'm wondering if you just elaborate on those pillars of the new school and why they're so important.
Absolutely. The pillars are key to what is different about our medical school. I started saying that this is a medical school of the future, meaning that we have to come up with new ideas that really will help us deal with healthcare in the next 30, 50 years. Those pillars define how we intend to disrupt healthcare. At Ryerson, I think we are very known that we push boundaries, we think out of the box, and I think we need those ideas to be applicable to healthcare. We don't want a traditional medical school that graduates traditional doctors. I think we have many of those schools in the province and in the country. That's not we are not duplicating those medical schools. The pandemic has presented many challenges to us, but also with challenges, we have many opportunities. First of all, the pandemic has shown that the healthcare system is not sustainable. We need to think differently. The pillars represent our principles for the future of healthcare, and we aim to tackle the challenges, as I mentioned, through an innovative curriculum that has those pillars. And let me elaborate a little bit on this. First of all is the focus on community-centric primary care and also the social determinants of health. Healthcare is not just about the diseases and so on, but also we have some elements because of social and cultural practices. That's one pillar. And because of that, we want to provide more culturally competent care to communities. There's no better place than Brampton and the Peel region to do that, because of the diversity of the population, because also of the cultural practices and the relationship to the well-being and healthcare of people. Number 3 is how to leverage innovation and technology to improve patient outcomes. I think this is one of those opportunities out of the pandemic. And I have seen, because of the pandemic, that many shifts in terms of the use of technology to deal with healthcare. I think that's a way to go for the future. Number 4 is to provide future physicians with the skills to develop interdisciplinary networks of healthcare to achieve better outcomes for patients. And I think this is an important aspect. We want to integrate, we want to have a comprehensive, holistic approach to healthcare. It's not about silos, it's about collaboration. And here, you mentioned the importance of partnership and collaboration. We see also that we can use many of the strengths that City of Brampton has. And we have initiated discussion with our partners in Brampton, with Sheridan College, with Algoma University, because they also have excellent ideas about how to improve healthcare. Algoma, for example, is leading this effort to help with mental health. And we know that mental health is a critical problem in our society. Sheridan has aspirations to push boundaries with more programming. And I think we have to use those strengths together to advance healthcare in Brampton and beyond the city of Brampton. And the last pillar is to focus on issues of aging and to support our seniors as growing portion of our society gets older. That's a reality. And we have seen it also during the pandemic. So those are kind of the 5 pillars that we are using to establish this new kind of medical school of the future.
It seems that this is a very compelling and very relevant contribution, investment into the Ontario landscape, into Peel Region's enhancement of medical care. You make some really, really good points. I think those pillars in terms of being community-centric, addressing the specific needs within Brampton, be it diabetes, be it mental health, the collaborations with the other institutions like Algoma and Sheridan. I remember the 3 of you led a very compelling vision, shared a very compelling vision with council prior to the pandemic, where each institution can provide unique contribution to really enhancing health innovation here in Brampton. And those pillars, the social determinants of health being the focus, is just bang on. And congratulations for not only articulating a vision, but moving forward during some very challenging times. You said it very well. The pandemic has been challenging, but it's true leadership and your view from the top to see the opportunities as well. And we definitely appreciate that. As a medical school, the concept of a medical school gains traction. There will be need for local resources. There will be need for supplies, for labs, equipment, housing for physician candidates, of course, research partnerships, and other ancillary services where Brampton businesses have a role to play and can play. Now, we've already seen some tremendous collaborations occur in your current investments. What a wonderful track record you've established in Brampton already with the Rogers Cybersecure Catalyst, for example, the Ryerson Venture Zone. Companies like Dynacare, Rogers, and many others are stepping up to help implement and execute on this very, very compelling vision. As we look forward, maybe you can comment on how important Brampton's business ecosystem will be to the school's success.
That's an excellent question, and definitely this idea of a new medical school cannot be done in isolation. The school definitely will need the support of the entire community to be successful, because we want this to be really about serving the community. And on that note, we are more than willing, actually, we are asking all stakeholders to be part of this venture, and especially the business community, of course. At Ryerson University, we believe in working with communities, not imposing solutions, but finding solutions with the communities. And this is why we are doing a lot of consultation at the present time with different organizations and different community associations to hear from them about what are the issues that we want to solve. And we are not bringing a model from downtown Toronto to Brampton. We want to develop a model that will fit with the needs of the city of Brampton and the entire region. So that's, I think it's a very important message here. Brampton has a vibrant, diverse, innovative business community that knows this market better than anyone. And this is why we need to work with them hand in hand. We need local business for their experience, expertise, locally based knowledge, that is focusing on innovation and entrepreneurship. And this will create, in my opinion, many benefits, spin-up benefits. When I mentioned about creation of an innovation healthcare hub or district, because we want also this to be a magnet to attract investments. We know in many places in the world that when you develop this type of partnership, you will have a lot of investments coming from outside. The perfect example that I give from the US is the Boston region. It's known to be the best place for innovation, for research and development for healthcare. Brampton has that opportunity, and this is part of the Toronto, Brampton, Waterloo corridor. So I think that's the important here. And it's an opportunity also for individual businesses to partner with us. We want also your ideas. And this is about you. It's not about the model that we have in other regions. Medical schools also, if you look at the economic effect of medical schools, they bring huge economic impact to local economies. And I can give different examples, but probably the smallest medical school in the country is the Northern Ontario School of Medicine,
Yes.
which is the youngest in the history of medical schools in Ontario. Actually, it's small size, but the economic impact, and this is published, a known fact, is almost $100 million in the impact on the economy. So I see huge opportunities for partnerships, for collaborations, but also huge opportunities to attract more investments, bring more energy, and more opportunities for people in Brampton.
Well, thank you, Dr. Lachemi, for that response. And, again, I go back to your track record of your first couple of investments here in Brampton, the Cybersecure Catalyst and the Venture Zone. We've seen companies step up like Rogers, like Dynacare, to assist with the training and learning. And those companies do that for a very particular reason. They not only want to support altruistically the vision that you have, but one of the major challenges that Canadian companies across the country, here in Brampton as well, have is finding and matching talent that can move their companies forward. And what a better way to find the talent of the future than to get engaged with our post-secondary institutions. And we're not talking just about healthcare here. Ryerson Venture Zone has finished their first year, some great success in helping startup companies in the health innovation field. But cybersecurity, for example, is cross-sectoral, and lots of opportunities. It's not just tech, it's not just health. And I know I'm very excited about Usha's plan at Ryerson Venture Zone this coming year on logistics, because this is a very mobile community, a logistic capital, as well as a cyber security training capital for our country. And I'm so happy that you mentioned the insights from those companies are what's needed for this next investment to be successful. And you've got a wonderful track record of success of the return on that investment if companies step up. So let's go the next step then. What are the biggest needs right now, and how can members of our business community get involved now and help move things forward?
Thank you very much for an important question, especially when you mentioned the need for talent. I can tell you that in a post-pandemic era, terms of recovery of the economy. The most important element, and that's what we're hearing most, is about talent. And we already have actually many areas where we see a shortage of talent. You mentioned cybersecurity. We know that there's a huge gap in talent for cybersecurity experts at the global level. And as I mentioned, on Monday, we had a tour of a couple of cabinet ministers to see the training center. And they talk to people who have been in that training phases at the cyber secure catalyst. And those are great ambassadors to talk about their own experiences. I can tell you that they're funding jobs at very high salaries because everybody's looking for people in cyber. Same thing in terms of healthcare. Because of the pandemic, healthcare is booming. I was just reading last night a publication from the US. We're talking about 2021. Of course, the year is not finished yet. $100 billion invested in healthcare. So I would say both healthcare and cyber are key to the future prosperity of our province and our country. In terms of what type of support and help, I would say we would love our business community in Brampton to help spread the word about our medical school. Help tell people how this medical school is going to be innovative, different, and also focusing on community needs. That's the most important thing for us. The new School of Medicine will be a hub for innovation and technology. We want local business to be part of serving the needs of hospitals, the needs of healthcare in general. And let me give you, talking about the business community here, because we looked at different models, and I had a chance just before the pandemic to go with some members of my team to see a very particular, actually, university that established a medical school in a small town in New Jersey. The name of the university is Ryerson University. And I would say, and actually I was talking to a number of counselors, inviting them to probably organize a tour and see what the benefit of having a medical school in communities like this. So we will create a health innovation district in Brampton, like Rowan in Camden, New Jersey. It's actually driving economic development in ways that I was not expecting to see. And it's a huge market for innovative technology-based healthcare outputs. I was talking to some officials from the city, and they said that this medical school at Rowan University attracted $2 billion in investments, a lot of new jobs, to the point now that 40% of all Camden jobs are in healthcare. So I just want to give here this example to show that when we talk about this new School of Medicine, is also talking about what are the opportunities for the city, but also for the business community to work with us and to contribute to a better Brampton.
Fantastic. And just the name of that university again, Rowan, R-O-W-A-N, is that correct?
Exactly. Rowan University, yes.
Fantastic. I know that you've mentioned it to me in the past, and it's so wonderful that not only do you have a compelling vision, a very solid business case, but you also have and track record, I should mention. You've got an example in another jurisdiction, a suburban jurisdiction that we can look at and look for opportunities of how to connect the business community with the success of the medical school. We've got a number of questions from our audience today, Dr. Lachemi. The first question I have is with respect to timing. You were successful in the last provincial budget in getting an allocation. Maybe you can tell us a little bit more about that for a proposal. When will the proposal be complete, and what are the next steps? Can you take us from proposal to shovels in ground?
That's another great question. I have to give credit also to the provincial government, because when we talked to them about our vision for Brampton, I can tell you the response was extremely positive, was outstanding support from the beginning, because they really liked this idea of helping the community develop something from the community. And they really like the idea of those 5 pillars that are really in relation to the challenges that Brampton has and the region of Peel, of course. So in the last provincial budget, as you mentioned, we got a grant to develop for proposal. We are working very hard to get this grant or application ready as soon as possible. We want really to put it as part of the cycle for the next budget. So it's an important milestone for us. However, in terms of when to start this, of course, you have to develop proposal, going through the process of accreditation, engaging the community. And we put actually a very solid senior advisory committee to help us navigate this. It's led by Dr. Andrew Padmos, who is extremely known in the area. He used to be the CEO of the Royal College of Physicians and Surgeons. And the composition of the committee has expertise and knowledge and experience that is extremely rich. So we are working with also people who know what are the needs in terms of healthcare. You mentioned my background in I'm an engineer background, so I'm just the ambassador, but the real work is done by real experts. The idea is, as I said, to work with the provincial government, hopefully next budget cycle, to have an official announcement about this. And I think for next couple of years are critical for us, really, to start to see implementation of the vision that we are sharing with this. But also we have some ideas where we can start working with the community. From now, I know that we initiated excellent conversation with our colleagues at Osler to start some concept of serving communities. We have some ideas about polyclinic that can serve the communities in their local areas. And those things can start actually from next year. And in terms of location, we have not identified a location for the new medical school, but would be happy to work with our partners there, the city of Brampton, the business community, to see what's the best location for the medical school. Because as I said, this is not going to be an isolation. We want this to be a hub where we can bring other partners to be with us. I can tell you, we're already discussing with some very important players in healthcare from the private sector that are looking actually to relocate from other locations. So I think there's an opportunity to attract them to the city of Brampton. So I would say the next couple of years are going to be extremely important for us. And I'm very positive and optimistic about making sure that we get the first cohort of students within the next 3 years.
An important role of the Brampton Board of Trade as the local Chamber of Commerce here for Brampton not only is connecting businesses and connecting businesses with the community, encouraging them, empowering them, but it's also the advocacy. And please know that you do have an ally here in the Brampton Board of Trade, the men and women, the businesses, the volunteers of the Brampton Board of Trade, to assist you at each step along the way. That's encouraging that you're looking at having a proposal complete in time for the next budget cycle. And I hear you when you're still open to ideas on scope and scale dependent on partnerships. So this is an open invitation to the business community from Dr. Lachemi to provide input. And if you're thinking of expansion and you can help build ancillary services to the medical school, now is the time to reach out. And Dr. Lachemi, who is it best to reach out to? Would it be you directly? Is there a quarterback on your team? If businesses would like to discuss investments they could make in helping the medical school be a success?
I would be happy to definitely to talk to any potential partner in the region. We do also have members of our team that are spending a lot of time in Brampton. My colleague Noman Khan, I see his name here in the chat, is the person who is now actually helping us with outreach in the city of Brampton. I would say he could be the point of contact to start any conversation. And also my colleague, Jennifer Grass, that Todd, you know Jennifer. Jennifer has been very active working with you and others in Brampton. She's our EVP University Relations. So those are the three names that you can contact to start the conversation.
Fantastic. You do have an excellent team, and Nauman has his coordinates in the chat. Jennifer Grass is always a pleasure and very insightful, very strategic. You've got a great team there, and this is very, very exciting. I see that we're coming quickly to our close. I wanted to just ask one more question from our audience, Dr. Lachemi, before we close out. Thinking ahead, ancillary services, be it School of Nursing, School of Paramedic Care, School of Pre-Medicine, Pharmacy, Chiropractic. How can those ancillary services how might they fit into the planning, the proposal for a medical school? I see one more question here too. Family services. So you've really stimulated a lot of thinking here in today's session of integration of family services and other disciplines. Can you tell us what's the realm of possibility for future investments associated with the medical school?
One of the 5 pillars of this medical school is this concept of developing interdisciplinary networks of healthcare professionals. So I think that's the answer to the question. Yes, we need to have a network of professionals that can help us deal with healthcare in the region. And I have actually mentioned this concept of a polyclinic where we see actually people from different areas of healthcare contributing to this. So we welcome those opportunities for collaboration. And this is why I mentioned the need to have partnership in the region with existing post-secondary education institutions. You mentioned nursing. I know that Sheridan is very, very active in establishing a presence in terms of nursing in the region. I mentioned Algoma University with an institute for mental health in the north, but the idea of talking to Algoma is also why we don't benefit both the south and the north in this. And mental health is something that we have to deal with it because it's part of the challenges that we have in society. So I see actually this as a very comprehensive way of dealing with healthcare. It's not just about medical doctors. We don't want this just to be siloed with the training of medical doctors. I think it's important to change the way that we provide services where we see collaboration with different professionals in healthcare to achieve better outcome for patients.
Well, this has been a truly inspiring conversation, Dr. Lachemi. Your vision for a community-centric, collaborative, tech, mobile, and innovative medical school, a medical school truly of the future, located in a community, Brampton, that has unique features that will make it a success. This is a success story in the waiting. And you've done a very good job of articulating a vision. Your leadership and the leadership of your partners here in the community at Osler gives tremendous amount of confidence that this vision will be implemented. I think you've got a lot of business people today excited about and thinking about ways that they can contribute and benefit from your plans. I want to thank you and your team again for an inspiring conversation today. Your view from the top is certainly one that will play a big part in Brampton's positive future. So thank you, sir, for your time here today.
Thank you very much. It was really a pleasure, Todd, to be with you this morning.
I want to also thank our sponsors again, CN, Deloitte, Meridian, and Rogers, for making today's View from the Top with Dr. Mohamed Lachemi, Ryerson University President and Vice-Chancellor of Ryerson University, possible today. I want to invite you to stay in network. We will be continuing on this Hop-In platform for another 30 minutes. You can see some icons on your screen there. You can do some one-on-one networking. There's another icon for our expo. Be sure to explore that before you start your business day today. Stay, chat, build your network. If you enjoyed this session, we have one more event to close out Small Business Week, and that is with the Honorable Steve Clark. He is the Minister of Municipal Affairs and Housing. He's going to be joined with President of the Treasury Board, the Honorable Pravneet Sakaria, and the Parliamentary Assistant for Infrastructure, Amarjo Sandhu, next week, October 27th at noon. It will be an engaging conversation about the needs in our business community, from affordable housing to how we are governed here in Peel and in Brampton. Don't miss it. You can register at bramptonbot.com. Last note, ladies and gentlemen, is we launched this week, Small Business Week, our Ready in Brampton campaign. And I think Dr. Lachemi said very well, this pandemic has had a lot of challenges, but it's brought opportunities as well. Our small business community bore a tremendous burden, an above average burden in terms of the longest lockdown in the world here in Ontario. So this is our chance to give back to the small business community, to show some appreciation, show a bit of love. When you're out at the barber, at the retailer, at a restaurant, take a photograph. Can you take a photograph? Can you say thank you? Post that photograph with the hashtag ReadyBrampton, because if you're ready to shop, ready to dine, ready to work, ready to play, we're ready here in Brampton. I want to thank Dr. Mohamed Lachemi again for another step in making Brampton future ready, an engaging and inspiring conversation we had today. I want to thank you all for your questions, and we look forward to seeing you at another Board of Trade event sometime in the near future. Thank you, everyone.
Thank you.
Thank you, Dr. Lachemi.